As someone who's been on active surveillance for 15 years with a recent MRI showing no progression, I'm often thinking about the long term. I recently spoke with a man on active surveillance for 20 years whose cancer has become metastatic. That possibility is on the minds of many men on surveillance. In simple terms, what can ArteraAI tell a man like me, and what can it not about long-term risk? Meaning, if a man on active surveillance has another biopsy 2, 5, or 10 years after his first biopsy, can ArteraAI use that new tissue to update his risk, or does it only work on the original biopsy?
For men who are in active surveillance, of course, the desire is to get as long as possible in active surveillance and really delay the need for surgery or for radiation therapy. And it can be really a powerful approach to make sure to delay the need for treatment. Of course, the question is how long can active surveillance be followed? Which patients are great candidates for active surveillance, and we want to identify any risk of progression before it happens, of course.
Sure.
The Artera test can be an effective tool for estimating a patient's risk of an adverse outcome after active surveillance or distant metastasis in the future. And in that way, it can help give a sense of like your customized or tailored risk to take a more nuanced approach for it. We've primarily worked on validating the ArteraAI prostate test for men who have an initial diagnosis and who have that first prostate biopsy and are making that decision about active surveillance and versus surgery or radiation therapy. And so our best evidence is in that situation.
Okay.
But you started off by mentioning, what if you have a subsequent biopsy? And what if something changes on that biopsy? And I think that's a great question. And I think in that instance, our test is validated on the individual specimen in terms of where that patient is on their journey or experience. And so certainly if there's a significant change in that specimen, it would be very reasonable to take another look at it with the test.
But what I'm asking is, so oftentimes a guy who's been on active surveillance for years, I don't want to end up in the same fate as the guy I spoke with a few weeks ago, whose prostate cancer, for 20 years, he's been on active surveillance. He thought he'd been on top of it, but now it has spread. And so let's say after 10 years of being on active surveillance, you get another biopsy. Would you all be able to look at that tissue and see if the risk has increased? Does your software do that? Does AI do that?
Absolutely. So as I understand your question, it's about can we look at that new specimen and calculate a new score there and give sort of fresh information? Because every time you're going through that's a new decision to make. And I think it's a great use of a test like the Artera test to analyze that specific sample and give you, real-time insights into what's going on with your cancer and better understanding the risks so that you can make a decision. So I think it's a great use of this technology.
Okay.